Hello, dear colleagues. How are you? My name is Mynzhylky Berdikhojayev, and this is a Presidential National Hospital in Almaty city, Kazakhstan country. My assistant is Rowan ITD, and operating nurse is Bakht, and the second nurse is Nazgul, and anesthesiology nurse is Жанна, and anesthesiologist is Davren Abildej. Video support today presented by Evgeny Grishayev and Video company team. And this is a case number 1. Patient under local anesthesia, young lady, 48 years old, with unruptured nearly 6-point-something millimeter aneurysm. This is a beginning of the small aneurysm on the MCA, and let's see the 2D images. Так, Eclipse ашасыз. Just a second, Eclipse андай үлкен ішінен екеу шығатын. Сосын Headway 27-ін ашасыз. Фен керекке раунд айтасыз, 90 градус бұрсын. Headway 27-ін 90 градус бұрсын. Just a second. Женя, нужно будет пока на КТ оставить, я превью. We should check the images of the patient from yesterday. I'm so sorry. Now Evgeny will switch for the CT. На КТ надо будет выставить, но пока другого пациента посмотрим. Хорошо? На КТ же стоит? Не, надо будет КТ переставить. Ага. Можно, да. Окей. Now we will check. Кім деген?
Акимтаева. Несін көресін ашып көрсі артериясын. Акимтаева.
Подожди, стадия. Because in parallel, Maksat Musabekov is checking the images patient with epistaxis operated yesterday from the ethmoidal arteries, and now the patient has a repeat bleeding. That's why he's planning to do sphenopalatine artery embolization. Okay, we are short from 17 microcatheters. We have just 3 of them. That's why we should work with the Penumbra P400 coils. And for the Penumbra P400 coils, we will use Headway 27. Okay, let's check. Экранды бір 20 сантиметр аяғына қарай сосын тарта салыңыз. Okay. This is a right territory and vertebral-basilar system. Everything is okay. The right side is okay. Өзіңізге қарай тарта беріңіз. И, okay. Thank you, Bakht. And now Maksat is measuring, downloading the images of the patient. From 2D, the ophthalmic artery is coming from the from side of the okay. Okay, now it's look like this. Now we can zoom it. In Kazakhstan, the system like this only in our hospital, when we can zoom the part of the screen. In many hospitals it's not available. It was the first biplane machine in the country, that's why as an advertisement Philips company put the nice flex vision system. 3.7 we should use 4mm stand. We short from the stands, that's why we will try to do simple coiling, not simple, balloon assist coiling. We took 8 French sheaths and Neuromax introducer sheath, long sheath, which is 6 French, but when you use it like a guiding catheter, it's 8 French. But inside you can put 6 French guiding catheter. As a balloon assistance, we asked Bachet to give a Eclipse single lumen 615, which is the most available on the shelf, and only two or three double lumen Eclipse we have on the shelf. But for this case, it's not necessary. All patients for the elective aneurysm and nowadays for the petroclival meningiomas, we are preparing with the dual antiplatelet. We are preparing with the dual antiplatelet, and this patient prepared with the ticagrelor. The loading dose is 180 milligram. 180 milligram, it's a loading dose, and since since 2000 something, nearly more than 10 years, we are premedicating the patients with aneurysm, and we started premedicate the patients with the petroclival meningiomas because in some of the cases it was necessary to use a flow diverter stent for the migrated liquid embolic in the ICA. It's quite safe. We showed last time, and patient finished the case without any complication, and FD is fixed the liquid embolic to the ICA wall, and yes. And on the control image, the penetration of the liquid embolic goes as much as possible. And I hope my young colleagues will describe that case, and we can publish as a case presentation. Надо опубликовать. Yes, it's quite... Так, headway... чекай обычный. Розовый чекай бересешь? Бахат? Чекай розовый. Розовый. Yes. We have only 2 or 3 чекай blacks, and that's why we should adapt only 3 flow diverter stands are available on the shelf. And in the department we have 15 or more patients prepared for the surgery for today and tomorrow. And tomorrow evening I should fly to Singapore, to Anil, for the World AVM Congress. And I hope to see my friends in Singapore. That's why we should operate 15 plus patients in a couple of days, today and tomorrow. Yes, I suggested, advised, recommended to the hospital administrations to stop the patient hospitalization because of the situation with the instruments. The tender just finished, and we are waiting for the instruments in next 2-4 weeks. That's why we will do it like in resource limited countries. Okay. Қорықпай жата беріңіз, жақсы ма? Мен Mynzhylky сайлаушпын. Мен осындамын. Okay, let's take coils. 4-10 деген спираль ашып бересіз. Опа. 4-10. Жоқ, мынандай. Осымен жұмыс істейміз. Біреуін просто ашып қоясаңыз, біреуін дайындап қоясаңыз. Окей. Yeah, біреуін ашып қоясаңыз. And also we have an issue with the medication also. Yes, as you have seen. Okay, let's show how to properly prepare the balloon. As I learned from René and Alberto and other colleagues, after the navigating in the cervical ICA, it's possible just inflate the balloon to check the contrast. Yes, this balloon is properly prepared. I checked it in the saline, and now we can navigate the. Yes, it's a click-on. Yes, we can also use the 2D, 3D roadmap, but yes, it's a MCA territory. It's upper branch. And also we should keep in mind there is a aneurysm formation on the MCA. I will show you. Анжерде кішкентай аневризм бар. It's a baby aneurysm, just newborn. It's aneurysm, huh? Yes. It's a microaneurysm. Yes, that's why it's a multiple aneurysm case, but for this case we have no we have no 17 microcatheters as much as enough for enough material. That's why we will do it next time. Okay, now balloon is in place. Чуть-чуть контраст. Вперед. Стоп. Okay. Yes, balloon is a device for the security because we will navigate the 27 microcatheter. It's not a PX slim as usually used for the navigation. Okay, there's some problem. Oh, it's ophthalmic artery, of course. When you don't need to go to the ophthalmic, you're going to the ophthalmic. Huh? And, you should know the catheter name is Headway 27. The balloon is Eclipse and catheter is 27. It will try all the time to go. Okay, now we are inside. Yes, comparing with the Chikai Black, the regular Chikai is quite soft. It's quite soft. Yes, and because of the angulation, okay, now we're inside the aneurysm. Yes, if it's possible, the better to do the curve inside the aneurysm with the wire. Then the microcatheter navigation is safer. Кондиционерді 24-ке қоя салыңыз. Бақыт. Yes, it's a little bit hot in the operating room, but outside is 0 degree. This is a Penumbra P400 coil. We ask for 4x10. But the aneurysm size is nearly 7 millimeter. It's quite a big coils and до конца идти. Аккуратно. Не моток крыжок. As much as possible, we will occlude the aneurysm, and then later on we will see the configuration. Okay. Okay, let's measure the ICA again. We have 3.5 Achero and Elvis Evo, but both of them goes through the 2017 microcatheter. It's only the problem, the 17 microcatheter. 2.6. Okay, 2.6, 2.7. And the aneurysm size MCA is 2.6. The diameter of the ICA is equal to the diameter of MCA, 6.6. 6.7. Okay. Let's see what we can do. Yes, I hope it would be not the emergency situation. Yes, coil is going. The recommended micro catheter from the company is a PX Slim. PX Slim is a 25th micro catheter, 25 system. That's why. Yes, when you start to inflate the balloon, then you should pull a little bit the balloon and keep it in tension. It will keep it in the position. Okay, it's maximum. No? The detachment is easy. Just pull it, and now it's detached. I hope the coil will be stable inside the aneurysm, but one of the loop could be faced with the aneurysm neck. We have enough place, huh? Maybe one more 4x10 or 31, 36? 36 душа, да? 4x8, 36. Yes, it's quite tall micro catheter. Может, спиральмен көреміз. Поток шо ғана. Okay, let's see. Дәулет is showing. Келесі ғой, да? Келе берсін. Yeah. Okay. The second coil is 4x8. I didn't check the shape of the coil. It's a complex. The previous one was also. No, it was helical, and this coil 4x8 is complex. It's a quite soft coils. It's a big coils, but it's a soft coils. Okay, we detached. It's easy. I think we should take something small. Үште төрт дұрыс па, үште үш дұрыс па? Ромарыч. Анау сәл қиналып кірді, иә? Үште үш пен екіде екіні дайындап қоясыңызшы. Үште үш комплекс. Андай, шимақ. Астына, сон астына. Екіні де аласыңыз.
Екіде тұрды ма?
Екеуінде, үшеуінде аласыңыз. Алдымен үште үш ташыңыз. Patient has a good collaterals. You can see the PCOM and there is also ACOM. That's why balloon could be inflated. Yes, Maksat is checking the case from yesterday. It's an epistaxis case, and they occluded ethmoidal arteries yesterday. Немен кірді екен? Соникпен кірді? Х2 17. Бля, мынандай артерияға Х2 қолданған. Вообще паразит екен. Кеше дуы болып еді. Yes, I don't understand my colleagues. They used the last available headways for the epistaxis. That's okay. It's going. I think we can use 2x4. Екіде төрт кіріп кетеді, или екіде екі кіреміз. О, екіде. Или сәл қиналды ма? Bunun bir жаман жері кесе алмайсың. This was 3x4 and now we are thinking about 2x4 or 2x2. Okay, let's try 2x4. Huh? Или 2x салсақ. 2x2-ні бере салс, соны бітірейік. Просто бір жаман жер бұл үлкен спиральда и көп орын алады. 2x2 дұрыс шығар.
Қалай әдемет етіп ме?
Қолмен. Аксиом сияқты. Көтен жағын тарта саласың болды. Қазір көрсетем. Бақыт is interested about the detachment system. There is no detachment system, just hand detachment. Жоқ, керек жоқ. Қанша болып жатыр? Ішіне салыңыз. Қазір бітіреміз. Қорықпай жата беріңіз, бәрі ойдағыдай. There is little bit hypertension. I hope it will be okay. The patient is hypertensive. Yes, I think 2 was the correct size. Yes, now the microcatheter is coming out. Yes, it was exact size. Просто тарта салынды. Мен бүйтіп тарта салдым. Қара жеріне. You should just take the tail and just little bit pull it and coil is detaching. There is no need 1 meter pull. Okay. Let's deflate the system and I hope the coil mass will be stable. Yes, it looks like stable. Okay. During the control angio, it's important not to force injection. Sometimes the power of injection is factor of coil migration. Okay, and now we have 0 roadmap, and under 0 roadmap we can take out the coil and take out the balloon, and coil mass is stable. And after the taking out the micro instruments, the first action should be guiding catheter replacement to the common carotid territory, which is very important. Now we can do the injection. Yes, the brain is clear, the aneurysm is occluded. For the MC aneurysm, we will call the patient for the next session. It will be in April. And then we can do stent monotherapy for the microaneurysm with the braided stent, and I think it will be okay. Okay, now we can take out the guiding, and I will ask Rowan to do expert CT. It's a protocol. After every procedure. Бәрі ойдағыдай өтті, көзіңіз ашыңыз. Бәрі жақсы. Басыңыздан тағы бір кішкентай аневризма анықталды, оған 1 айдан кейін келесіз, жарайды ма? Ол жерде тоже осылайынан местный анестезиямен стенд қойып береміз. Жақсы? Қазір КТ жасаймыз да бітіреміз. Dear colleagues, the CT is ready. It's a part of the protocol in the department. The brain is clear. There is no contrast stagnated branches, which is good. This is an artifact from the coil mass. And now we can see the coronal view. Everything is clear. The next case will be the epistaxis Maksat is doing. That's why we have the break, nearly 1 hour, and see you in 1 hour. Next case is aneurysm case. Epistaxis we will not live stream because it's Maksat's case, and then aneurysm case. Okay, thank you.